Well, doctors have recently seen an increase in COVID-related hospital visits, but officials say ICU visits haven't gone up nearly as much. Anna Hansen joins us now and explains.
There's currently a rise in COVID-related hospitalizations, but not in intensive care patients for the virus. In speaking with Dr. Jeff Pothoff from UW Health, I learned that the disparity there can be explained by earlier hospital visits and higher vaccine rates.
A rise in hospital visits.
As a community starts to tangle with COVID-19, that virus becomes more prevalent.
But not in ICU beds. This difference may seem strange, but according to UW Health's Dr. Jeff Pothoff, it isn't without explanation. He says that there are a couple of reasons for the gap.
Typically, early on, the rise is going to be predominantly in general care cases. Most people start to get worried about their breathing before they're that sick.
As more people are hospitalized for COVID-19, only a portion of those patients will head to the ICU.
You'll start to see that ICU number increase a little bit later than just that general care number.
With 68.4% of Dane County residents fully vaccinated and masks being enforced again this week, hospitals in the county have been keeping up with intensive care patients.
We got to really low levels of COVID patients in May and June.
Pothoff says in his experience, it's also an issue of access and tolerance.
People have different thresholds for like, wow, I think I'm getting sick, I should go to the hospital. Probably has more to do with access to care and people's kind of ingrained thoughts about, when is the right time to come to a hospital.
And with the Delta variant looming, he hopes ICU numbers remain at a consistent low, opening up beds for those in need. He's concerned for Alabama, where just 2 days ago, doctors declared that they had no ICU beds available.
The Delta variant is throwing us a bit for a loop here. It could make for a messy fall.
Overall, Pothoff says the fight against the virus comes down to our own determination.
We just have to have the resolve to say, you know what, this totally stinks.
Dr. Pothoff also told me that while breakthrough infections are on the rise, they're typically mild and rarely require intensive care.